Assalamu alaikum. In this video we will talk about the first line drugs used for the hypertension. So what is hypertension? When pressure inside the blood vessel is persistently elevated from the normal, this is called the hypertension. So initial treatment is started with A, C and D. So in the category A we have the angiotensin converting enzyme inhibitors, or we have the angiotensin receptor blockers, which are almost similar in the action. Let's move toward the mechanism of action of angiotensin converting enzyme inhibitors. We have the angiotensinogen inside the blood, which is a protein in nature. It is converted into angiotensin 1 with the help of an enzyme called renin. Renin is actually secreted by kidneys, and it is responsible to convert angiotensinogen into angiotensin 1, and then angiotensin 1 is converted into angiotensin 2 with the help of an enzyme called angiotensin converting enzyme. Thus angiotensin 2 will cause the blood vessel constriction, and it will also increase the release of aldosterone. So aldosterone will cause the sodium water retention, thus blood pressure will be elevated. The ACEI drugs prevent the formation of angiotensin 2, so it prevents the hypertension. The ACEIs are the ARBs drugs. These are less effective in the African American people and the geriatric people, but these drugs can be combined with the calcium channel blocker or diuretics for the better effect. Example of ACEI is the captopril, and the example of ARBs is the losartan. Side effects of the ACEIs are dry cough, bronchospasm, hyperkalemia, and loss of the taste. We can prefer ARBs instead of ACEIs because ARBs don't produce the dry cough, mostly in the old people. In the category C, we have the calcium channel blockers. These drugs actually block the calcium channels and thus cause the blood vessel dilation and reducing the blood pressure. The example includes amlodipine and verapamil. Side effects of the CCB is the headache, constipation, edema, and tachycardia. The most common side effect is the constipation. In the category D, we have the diuretics like loop diuretics and thiazide diuretics, but the most preferred are the thiazide diuretics. Example are the hydrochlorothiazide and chlorothiazides. The side effects of the diuretics, it decrease the level of potassium, magnesium and sodium, but it increase the level of glucose, uric acid and the triglyceride. Thus the initial treatment can be started with category A, category C or category D drugs.